Today we are going to discuss important long essay, short answer from Thanatology. Hello guys, am I audible and visible? Good evening. Good evening, Pioneer. Good evening, Suresh. Good evening. So today we are going to important long essay, short essay. Hello guys, audible and visible. Good evening. Good evening, Pioneer. Good evening, Suresh. Yes. Asrif Ahmad, good evening. Thanatology means study of death in detail. One very commonly asked topic in your exam, usually a part of forensic pathology. The forensic pathology around 25 marks. The questions commonly asked are define death, classify postmortem changes, explain in detail about Rigor Mortis, long essay. Livor Mortis, 5 marks question. Rigor Mortis, it can be a 10 marks question. Or sometime the color of postmortem staining, 3 marks question. Mummification, adipose reformation, usually 5 marks. Putrefaction, it can be 10 marks question. So in this session, we are going to discuss few important topics, few important concepts, along with the list of most expected questions. Yes guys, I'm audible and visible. Yes, Arif Ahmad, audio video, is it clear? Okay, let's start. Rakesh, is it okay? In the beginning, as a part of Booth Bungalow series, here is a case of unnatural death. The postmortem was conducted as per 194 BNSS and 103 BNS, that is murder, the guilty mind and guilty act. The history is, it's a case of Mallika. The Mallika was the accused or the culprit or the female serial killer, befriended women at the temples, gained their trust by posing them as a deeply religious woman, promised special puja to solve their problems, asked victim to wear their gold jewelry, took them to isolated temple, gave them some holy water mixed with the potassium compound. Victim died rapidly. She removed their jewelry and escaped. So this is very famous Mallika case. Very famous cyanide Mallika case. The postmortem staining color is brick red in color. So it's a cyanide murder basically. My question is, what is the cause of death in case of cyanide? Can anyone? Cause of death? Bhumika, Rakesh and others? Cause of death? See, cyanide is ideal suicidal, one of the ideal homicidal agent which causes a sudden death in few minutes. The manner can be accidental, like example Bhopal gas tragedy, homicidal, like example cyanide Mallika case, or it can be suicidal case. The cause of death is histotoxic anoxia. The cyanide inhibits complex 4. The complex 4 is cytochrome oxidase. When cytochrome oxidase is inhibited, that leads to histotoxic hypoxia or anoxia, leads to sudden death. So the answer is histotoxic anoxia. I wanted. Good answer. Many answered. Rakesh answered. Excellent. That's great. So with this introduction, let's start one important long essay and what to write and how to get distinction in forensic medicine. Classify postmortem changes. Postmortem means changes that occur after death. Antemortem means before death. Explain mechanism, order, appearance, causes, early onset, late onset, medico-legal importance of rigor mortis. Very important 10 marks question. It can be 5 marks question also. The postmortem changes are classified into immediate changes, early changes, and late changes. The immediate changes means somatic death, also known as clinical death. That is permanent cessation of loss of function of CNS, CVS and RS. You need to write like this: circulation, respiration and function of the brain. So these three systems, they are known as tripod of life. All of write in the chat box. Tripod of life. Tripod. CVS, RS and CNS. The very important 3 marks question. Some books gives these systems are known as atria mortis, gateways of death. The Thanatos, the Greek god of death or god of death emerge enters the body through 3 systems: brain, respiration and circulation. As you know, brain, so cerebral cortex, brain stem, reticular activating system, they maintains your consciousness. You are awake, you are conscious because of the RAS. Once brain is damaged, there will be loss of consciousness. Respiration controlled by medulla oblongata, inspirator neurons, expirator neuron, Pontine center, like apneustic center, like pneumotoxic center and all, they maintain respiration. So respiratory damage or respiratory failure can lead to death. Circulation, especially, that is heart attack or basically heart failure. Yes, tripod of life. That's great. Fine. Then comes his muscle changes. Can anyone answer what is the muscle change occurs immediately after death? Immediately after death, what happens? What is the first muscle change that occurs? Anyone? So, muscle, they undergo primary relaxation, PR. So, what is the earliest change in the muscle? Primary relaxation. After that, there will be rigor mortis, secondary relaxation. So, primary relaxation occurs, immediate change. Then comes is the rigor mortis. Then secondary relaxation. This can be 3 marks question. The Viva question can be asked. How to differentiate between primary relaxation and secondary relaxation? Your answer must be, that is Zako phenomena. The Zako phenomena present in primary relaxation, absent in secondary relaxation, because there is a cellular death. In rigor mortis also there is a cellular death. Okay, fine. Then comes his pupil. The pupils are usually dilated. That is the immediate change. But during onset of rigor mortis, pupil can be constricted. In case of supravital period, the pupil can be stimulated. Either it can be constricted or dilated to atropine or the physostigmine. This can be Viva question. Pupil. All these are immediate changes. Then what are the early changes? Early changes means within 24 hours. Early. Basically, cellular death. There are 3 mortis. What are 3 mortis? One is rigor mortis. The rigor mortis is stiffening of the muscles because of ATP depletion. Very important point. Then there can be Algor Mortis. That is postmortem cooling. Livor mortis, that is collection of blood in the dependent area along with the contact pallor. So there are three mortis: rigor mortis, algor mortis, and livor mortis. Okay, fine. After that, there will be late changes and early changes. There can be eye changes also. Eye changes, skin changes as well. So there are 5 early changes after death: rigor mortis, algor mortis, livor mortis, eye changes, and skin changes. Then comes his late changes. Late changes basically because of the decomposition, or Clostridium welchii, or the Staphylococcus, Streptococcus. They produce powerful enzymes. So there are 3 changes. One common change is putrefaction. The second one is adipose formation. Then the mummification. Now I have a question for you. Medico-legally, which is very important: putrefaction, adipocere, or mummification. 3 options are there. Medico-legally, which of the following postmortem change is very important: mummification, adipocere, and decomposition. Anyone? Can anyone try? So mummification, the facial features are very well preserved. They are very well preserved. You can identify the cause of death, you can identify the injuries, sometimes you can identify the manner of death. That's why the answer is mummification. The color of dead body either black or brown color. Adipocere, basically the color is a whitish color. There is a formation of saponification, or the salts of the fatty acids. It occurs in humid environment. The putrefaction is the most common one. The color of dead body is green color. The question can be asked, why is it green color? Your answer must be sulf-methemoglobin. The sulf-methemoglobin or sulf-hemoglobin can give rise to greenish discoloration of the dead body. But during putrefaction, there are various postmortem artifacts. So these artifacts can affect the interpretation of injuries. When interpretation of injuries occurs, so there can be confused with the antemortem injuries that will affect the diagnosis, cause of death, manner of death, and all. That's why postmortem must be conducted within 3 days. So all these are very, very important concepts. So try to write in the exam immediate changes, early changes, and late changes. Most common question is basically rigor mortis. Is it clear, guys? Anyone, any doubt? Any doubt in this? Rakesh, Anu. Good evening, Anu. Good evening. Yeah. Okay. So this can be 5 marks question. चलो आगे देखते हैं. Now look at this. This is a classical eye finding during postmortem examination. Now I am in the Shaw Pariksha room. So during examination of eye, there is a triangular patch. Triangular patch like this. So which has base towards the cornea and apex is towards the sclera. It is also known as black spot. It commonly occurs in 3 to 4 hours after death. It shows time since death, 3 to 4 hours. It occurs when eyes are open, deposition of dust particle, desiccation of tissue. What is this known as? 3 marks question. The black spot over the dead body. After death, what it is known as? Yes, very good, Rakesh, excellent. Bhumika, this is known as tachynoria sclerotica. The time since death is 3 to 4 hours. 3 to 4 hours. This is very important concept. Then again, question can be asked, what are eye changes? Eye changes are like pupil is dilated, tachynuria sclerotica is seen, IOP becomes 0, there can be Cavernous sign in the retina and all you can write. So 3 marks usually question. Okay, that's fine. Now look at this now. This is again, we are in the Shaw Pariksha room, Booth Bungalow room. So in Booth Bungalow room, what you can see here, greenish discoloration. At the ileocecal junction, my question is, what is this postmortem change known as? Anyone identify? And also you can see postmortem artifacts. What is this? So 2 findings are there. Finding number 1 here, finding number 2 here. Bhumika, Rakesh, try answering. The finding number 1 here is greenish discoloration because of the sulf-meth hemoglobin. That is the earliest feature of putrefaction. The Viva question can be asked, what is the earliest finding in putrefaction? Your answer must be greenish discoloration at the right iliac fossa. Internal finding, that is the greenish discoloration at the blood vessel or the undersurface of liver. Very important MCQ. Why is it green color? Sulf-meth hemoglobin. It commonly occurs at the ileocecal junction, right iliac fossa. Important question. Now look at the second finding. So this is basically putrefaction, I said. Putrefaction. This is postmortem artifact. This is basically CPR injury. Defibrillator injury. Okay, you can make out now. I think close observation you can make out. The dead body never lies. लाश एक मुख गवाह है जो कभी झूठ नहीं बोलती. This is postmortem artifact. So in case of defibrillator, because of the chest compression, there can be fracture of 3rd, 4th and 5th rib. Sometime there can be fracture of C7. So during the transport of the dead body, that is known as undertracheal fracture. So postmortem artifact can be 5 marks question. After the class, go through 10 important postmortem artifacts. Is it clear, this image? Yes. अनु, भूमिका, समझ में आ रहा है ना आपको? Yes. चलो आगे देखते हैं. What is rigor mortis? Very important question. The rigor mortis means stiffening of the muscle. So definition like this. Rigor mortis is early postmortem change characterized by shortening and stiffening of muscles of the death that follows period of primary flaccidity. This is very important definition. So to get distinction in forensic medicine, the definitions are very important from the standard textbook. What is rigor mortis? Your answer must be like this. Sir, this is early postmortem change, not immediate or late. Postmortem, it is not antemortem. Characterized by shortening, little shortening, but very heavy stiffening. It occurs in all the muscles, voluntary, involuntary, all the muscles. That follows period of primary flaccidity. Primary flaccidity, rigor mortis, secondary flaccidity. My question is, the first site of rigor mortis, anyone? What is the first site of rigor mortis? Anyone? Try. Let's make it interactive. Rakesh, Anu, Bhumika, can you try? True life. Excellent. True lifestyle with Aliza. Remember the first muscle, that is basically the cardiac muscle. The heart is the first muscle. The second muscle, eyelid muscle. The last muscle is the fingers and toes. Small muscles, fingers and toes, as per Nisten. Rigor mortis starts simultaneously in all muscles, but it is evident in some muscles in early stage. So the first muscle rigor mortis, last muscle fingers and toes. हो गया, बहुत बढ़िया. Now this rigor mortis is confused with some conditions, like example heat stiffening, cold stiffening, or it can be cadaveric spasm or gas stiffening and all. chemical stiffening as well, differential diagnosis. Condition simulating rigor mortis, 5 marks question. Condition resemble like rigor mortis, 5 marks question. Okay, so after the class you can just go through that. Okay, okay, chalo, bahut badhiya. Mechanism is ATP depletion. As you know, muscle contraction, excitation, contraction, coupling. Actin combines with the myosin. For relaxation, we need ATP. When ATP is not there, so there will be sustained contraction state. That is known as rigor mortis. It is also known as acid rigor. Okay. Order, basically Nishtan rule. Nishtan rule. You can also write rule of 12. Shapiro rule. So rule of 12 means rigor mortis develops in 12 hours, maintained for 12 hours, disappears in 12 hours. That is rule of 12. Shapiro rule, rigor mortis has proximo-distal progression. That is known as Shapiro rule. Nishtan rule, that we are going to discuss in next slide. Differential diagnosis, I said heat stiffening, HS, cold stiffening, CS, chemical stiffening, gas stiffening. Okay, ठीक है, reps, चलो, ठीक है. The medico-legal importance, you can estimate time since death. It's a sign of death. It's a sign of cellular death. Sometime it can give you some idea about, the number of hours that is passed between the postmortem examination and the time of death. So that we call it a time since death. It's a sign of death. It's a sign of cellular death. When rigor mortis is there, that means the person is dead. So that is the meaning of, okay, chalo, bahut badhiya. Then what is the Nishtan rule? Nishtan rule, look at this: heart, then eyelids, neck, lower jaw, face, chest, upper limb, abdomen and uterus, lower limb, fingers and toes, disappears in the same order. Now my question is, say example, rigor mortis is there in upper limb as well as lower limb. Rigor mortis present in upper limb as well as lower limb. My question is, what is time since death? Simple question. Very, very simple question. So I am in the Shaw Pariksha room. During postmortem examination, rigor mortis is present in upper limb and the lower limb. The question is, what is time since death? Anyone? Ashutosh, Pradhan. Anu is telling sir more than 11 hours. Yes, it is usually more than, it's 9 to 11 hours. 9 to 11 hours. Okay? Is it clear, guys? Is it clear? Any doubt in this? Rigor mortis, any doubt? Ashutosh, Pradhan, Anu, Bhumika, Rakesh. Rigor mortis, very, very important. So you need to write definition, mechanism, then differential diagnosis, then medico-legal importance, early onset, late onset, and other findings. So that's it about the rigor mortis. Rest all you can write. Anu is telling sir, no doubt. Chalo, theek hai. Bahut badhiya. Now I have an image-based question now. Look at this. This is a case of drowning, okay? Drowning, hand like this. In the hand, there is aquatic matter. The aquatic matter is there. Sometimes mud, sometimes diatoms. What is this basically? And the muscle contraction is so severe, so strong, it is stronger than rigor mortis. Commonly seen in case of drowning. Or sometimes like this, firearm is found in the crime scene. within tight grip of the hand. Pistol, revolver, like this, like this. ये क्या है बताओ? ये क्या हो सकता है? So this is classical cadaveric spasm. Very good. Cadaveric spasm. याद रखना एंटीमॉर्टम है, मतलब it occurs before death. So it shows manner of death. It shows manner, sometimes cause of death. Very important finding. It is also known as cataleptic rigidity. And one more point, remember, the pH of the muscle is alkaline. Alkaline. Very strong contraction. No other method can produce cadaveric spasm. It is also known as instantaneous rigor. Instantaneous. Antemortem. बहुत बढ़िया. ठीक है? Fine. The question can be asked, this image. Now look at this. This is again differential diagnosis of rigor mortis. During Shaupriksha examination, now a case of bone injury. So when body exposed to more than 70 degree, all the muscle protein that is showing coagulation, okay, that is denaturation. So hands are flexed, elbow is flexed, neck is elongated, hip is abducted, flexed, knee is flexed, claw hand. What is this known as? So this is known as heat stiffening. Also known as pugilistic attitude. Okay, pugilistic attitude, heat stiffening, boxer attitude. Now remember, this can be antemortem or it can be postmortem when body exposed to more than 70 degrees Celsius. So it has no medico-legal importance. If they ask you in Viva, what is the medico-legal importance of rigor mortis, it is very important. But heat stiffening, medico-legally not important, because it can be antemortem, it can be postmortem. So when body exposed to more than 70 degree, all the muscle protein, actin, myosin, tropomyosin undergo denaturation. ठीक है? Okay. हो गया. Rakesh, good. Then look at this. Again, Shaupriksha room. The dead body exposed to extreme temperature, minus temperature, minus 10, minus 20. You can see here coagulation of proteins. What is this known as? This is known as cold stiffening. And a cold stiffening, there will be formation of ice crystals within the joints. So there will be crackling sound in case of cold stiffening. Like ice when it breaks, no crackling sound will be there. So that is the feature of cold stiffening. Again, antemortem, postmortem. It has no medico-legal importance. So this is the third condition, resemble like rigor mortis. Okay, frostbite, okay, frostbite, that's okay. Now look at this. This is one more condition, resemble like rigor mortis. Now try to understand, this is marbling. This is marbling. And there is a gas formation within the skin. So there is a formation of gas within the skin. You can see the marbling here. You can also make out here. So this is putrefaction. This is known as gas stiffening. The gas stiffening because of the putrefaction. It is usually postmortem. Always postmortem. Okay? Produced by Clostridium welchii and other bacteria, gas forming bacteria. So bloated abdomen, distorted facial features, postmortem purging, greenish discoloration, all this because of Clostridium welchii. Clostridia, वेल्ची, ठीक है, मॉबलिंग, वेरी गुड, दैट्स ग्रेट। आगे देखते हैं मेडिको-लीगल इंपॉर्टेंस ऑफ राइगर मॉर्टिस। आई सेड ऑलरेडी, श्योर साइन ऑफ डेथ, estimation of time since death, body position, it shows body position, sometime it shows cause of death, sometime it is mistaken for other conditions like cold stiffening, heat stiffening, gas stiffening and all. So this is about the rigor mortis. In general, it can be a 10 marks question. 10 mark question. This completes the rigor mortis, which is very, very important question. So the importance of FARRE is to stress on the most important question asked in your Viva and in your university exam. If you write these points, that is more than sufficient. So after the class, I'm going to share the notes. Just go through the notes. This is more than sufficient for your main question, rigor mortis. Yes, चलो बहुत बढ़िया। नेक्स्ट देखते हैं नेक्स्ट टॉपिक। What is the next topic? The next topic is difference between rigor mortis and cadaveric spasm. Already we discussed that. You can just go through this table. And the third question is from the autopsy. Mention the types of skin incision during autopsy. Skin incision or sometimes techniques also question can be asked. Skin incision, then techniques. So techniques, very important. And one more question asked, viscera. The skin incision can be different types: I-shaped incision, Y-shaped incision, modified Y, X-shaped incision, T-shaped incision, fourth incision. So 1, 2, 3, 4, 5, 6, 7, or it can be inverted Y also. Inverted Y. Okay. I, Y, modified Y 3, X हो गया 4, T-shaped incision 5, 6, total 7 types are there. So if I write skin incision is equal to 7 types. Skin is equal to 7 types. लिखना पड़ेगा. लिखो. The most common one is I. Okay. Techniques, there are 4 techniques. Virtue, Letule, Gon, Rokitansky. So most common virtue, the best is Letule. Viscera, 3 marks question. What are viscera normally preserved? Stomach and duodenum in one bottle. Bottle number 1. Kidney, half of each kidney. 500 gram of liver along with the gallbladder in bottle number 2. Sometimes spleen also. Blood, the bottle number 3. Urine, bottle number 4. Bottle number 5 is preservative. So in any case of poisoning. So 3 marks question, 3 marks question, 3 marks question. Okay, 7 types are there. Okay, chalo, बहुत बढ़िया. Now you need to identify. Now pictures are there. Try to identify. A, B, C, D and E. So fine, 30 seconds, 20-30 seconds. Come on, try. Yes, try. Okay. Anu, Rakesh. So the A is eye-shaped incision, extending from chin to pubic symphysis. So B is modified Y. So that is below the breast, very common in females. It has a cosmetic value. The D is Y-shaped incision. This is X-shaped incision in case of custodial death. So this is T-shaped incision. T. So T-shaped incision basically to dissect the carotid arteries, jugular vein, carotid arteries and all. Any embolism, any formation of clot and all. X-shaped incision over the back in case of custodial death. I-shaped incision is the most common incision from chin to pubic symphysis. So below the breast, cosmetic incision, that is basically modified Y. For the examination of neck in case of hanging and strangulation, that is basically Y-shaped incision. So there are 5. Inverted Y in case of infant death, stillbirth and live birth. Fourth incision, cosmetic incision, anterior incision, posterior incision, that is basically used in case of autopsy. One of the best incision. So one is the anterior incision and the posterior incision, that is known as fourth incision, cosmetic incision. Okay? Yes. Rache, clearance and others, very good. All are answering. That's really nice. Okay. Then the techniques. So there are 4 techniques are there, I said already. लेटुले टेक्निक. लेटुले मतलब एन मास टेक्निक है. मतलब you are going to remove all the organs at a stretch. All the organs from prostate to tongue to prostate. All the organ en mass. लेटुले. All of you write in the chat box. लेटुले मतलब एन मास. एन मास मतलब पूरा निकालना है. पूरा निकालो. Tongue to prostate, tongue to uterus. Remove all the organs at a stretch. So cut cervical organs, thoracic organs, abdominal organs, all the attachment remove at a stretch. ये हो गया लेटुले, मतलब पूरा निकालो. बट डिफिकल्ट टेक्निक है, बेस्ट टेक्निक है बट डिफिकल्ट है. सो एन मास है, एन मास डिसेक्शन लिखो. लेटुले मतलब एन मास, मास हीरो. एन मास, लेटुले इज अ मास हीरो. Can remember? Rakesh, keep writing. Letulle is equal to n mass. Then virtue technique. Virtue means 1 by 1. आराम से करना. 1 by 1. Remove organs 1 by 1. Like this. Remove the kidney. Examine, dissect. Remove the liver, dissect. Very easy technique. आराम से करना. मतलब virtue मतलब आराम से. कोई टेंशन नहीं है, कोई बात नहीं है. तो वो virtue technique है. गॉन मतलब आर्गन है. सो आर्गन ब्लॉक मतलब 3 ब्लॉक्स में निकालना है. मतलब क्या करना है? सर्वाइकल ऑर्गन्स को निकालना है, इसके बाद थोरैसिक ऑर्गन्स, इसके बाद अब्डोमिनल एंड पेल्विक ऑर्गन्स. हो गया 3 ब्लॉक्स में. सो नॉट एन मास, इट इज एन ब्लॉक टेक्निक. गॉन मतलब ऑर्गन ब्लॉक. रोकेटांस्की इन इन्फेक्टेड बॉडी. मतलब क्या है? मतलब है हेपेटाइटिस बी पॉजिटिव है, HIV पॉजिटिव है, हाई रिस्क ऑफ ट्रांसमिशन ऑफ डिसीज टू द पेशेंट, फ्रॉम द पेशेंट टू द डॉक्टर्स, पैरामेडिकल वर्कर्स आर द टेक्नीशियंस. सो दैट इज रोकेटांस्की. सो याद रखना पड़ेगा, लेटुले है पूरा निकालना है, वर्चो है 1 by 1 निकालना है, आराम से करना. गॉन है थोड़ा आधा निकालना है. इसमें क्या है? सर्वाइकोथोरैसिक होगा, अब्डोमिनल होगा और पेल्विक ऑर्गन्स. रोकेटांस्की मतलब इन सितु डायसेक्शन. मत जस्ट ओपन द अब्डोमेन, दैट डायसेक्शन इन सितु. नो नीड टू ओपन एनीथिंग. सो दैट इज नोन एज रोकेटांस्की. आयुष, राकेश, अनु. So very good. Letulle is en mass. Good answer, Rakesh. You are a mass hero, man. Mass hero. Anu, Ayush, great. Salute. हो गया. आगे देखते हैं. What are the, okay. Is it clear, guys? Any doubt in this postmortem methods? Any doubt? Come on guys, any doubt? Just tell me any doubt. If you have any doubt, you can ask me. You can interact with me, guys. So live class must be two-way communication, not one way. So you just write something in the chat box. Hi sir, yes sir, no sir, interesting sir, boring sir, fast sir, slow sir. So you can interact with me. You can keep me awake, yourself awake. Yes guys, come on, tell me. No. Okay, Rishank is telling sir hi. Rishank, one of my favorite student in live lectures of Sushruta batch. Hi Rishank, how are you? How is your preparation? I hope you will get distinction this year. I'm pretty sure. Rishank Dusani, how are you? I'm good. Ayush, okay. Chal. Next question hai, what are the components of routine preservation? Which already we discussed. Stomach content and all, no need to worry. Yes. Then, after this session, just go through these questions. Putrefaction, 10 marks question. In putrefaction, write definition of putrefaction, types of putrefaction, external, internal, order of putrefaction, what are the important changes and medico-legal importance. 10 marks question. Livor Mortis, 10 marks question. What is livor mortis? क्या होता है liver mortis? What is the mechanism of livor mortis? You need to write color of the livor mortis, medico-legal importance, primary lividity, secondary lividity, fixation of lividity, very important question. Algor Mortis, 10 marks question. Definition, the methods of heat loss, postmortem caloricity, medico-legal importance, eye changes, 5 marks question. We discussed already. Types of autopsy. There are different types of autopsy. Medico-legal autopsy, clinical autopsy, psychological autopsy, negative autopsy, obscure autopsy, okay, digital autopsy, endoscopic autopsy. So there are many types. The question can be asked, 5 marks question. Exhumation, second postmortem, removal of dead body from the grave. Time since death, sometime it can be 10 marks question. Various methods of time since death. Embalming, 5 marks. Mummification and adipocere. So these are most expected questions in upcoming exam. Okay, just go through this. Rama, Pradeep, Rama 07, that's great. Ho gaya. Now comes is the forensic spotters. So very interesting session now, forensic spotters. You need to identify. So for next 10-15 minutes, forensic spotters. The first spotter. इसमें क्या है? History is, it was a case of hanging. Okay, I remember a case of hanging. Dead body was found in a forest area in the month of May. Okay, I'm going to write here in the month of May. May matlab very hot. In a forest at a height of around 10 feet. A tree. It was in a case of hanging state. A case of hanging. So dead body discovered in June. After 30 days. During postmortem examination, all the facial features are very well preserved. Protruded tongue is there. Ligature mark is clearly visible. You can see the ligature mark here. The tongue is missing. Probably postmortem artifact. Look at the facial features. Facial features are very well preserved. Now this is the case of hanging. No injuries on the body. No injuries. Only ligature mark is there. So my question is, what is this basically known as? मॉमिफिकेशन, एक्सलेंट आंसर। ओके, ठीक है, बहुत बढ़िया। मॉमिफिकेशन, फर्स्ट आंसर बाय राकेश। राकेश, वेरी गुड। ठीक है, इट अकर्स इन hot environment and hot and dry with a free movement of the air, like example deserts. So this is mummification. What is the color of dead body? Brown or black color. There will be a loss of body weight up to 70%. So this can be question asked in your exam, 3 marks. Very good. Pradeep, Rachel, ठीक है. The next question is very important question. Look at this. A case of Shaw Pariksha examination, Bhoot Bungalow series. You can see here the person is dead. The person is declared dead. Confirmed case of death. But here atropine is instilled in the left eye and the pilocarpine in the right eye. So we can see here mydriasis, and here meiosis. My question is, the pupil is responding to atropine and also pilocarpine. Why? What is the significance of this? Anyone? I'm telling you, dead body was shifted to postmortem room immediately after death, maybe 2 to 3 hours, immediately for postmortem examination. So after installation of atropine, pupil is dilated. Installation of the pilocarpine, pupil is constricted. इसका मतलब क्या है, इसका इंपॉर्टेंस क्या है, बताओ, जल्दी बताओ. यस, ये टैकीनोरे नहीं है बेटा, टैकीनोरे नहीं है. ठीक है, ठीक है. ऋषंक, आंसर माय क्वेश्चन. Sir, if you remove all the organs in gone, Letule virtue, what is the difference even if you... Okay. So the question is very good question from Rishang. Rishang, remember, Letule is very good because you can identify inter-organ relationship. When you are removing all the organs at a stretch, you will come to know pathogenesis, the congestion, the continuation of congestion. Pathogenesis can be found out very clearly, Letule, but it needs 2 or 3 technicians to remove all the organs, around maybe 30-40 kg. We need 2 or 3 technicians. Very difficult technique to do. So that's why. Chalo, ठीक है. Anyone? What is this? Rudra is telling sir RAPD नहीं है बेटा. ये है supravital reaction. Supravital period. Supravital period is the period between cellular death and the somatic death. Example, this is somatic death, then cellular death, supravital period, then cellular death. So in supravital period, the eye can respond to atropine and also isostigmine or pilocarpine. So supravital period, मतलब जिंदा नहीं है, ये मर चुका है, फिर भी फाइंडिंग पॉजिटिव होता है क्योंकि सुप्रावाइटल पीरियड है, इसलिए. बहुत बढ़िया, आगे ठीक है. नोबडी आंसर्ड. ओके, चलो ठीक है. रुद्र गौर. ओके, नाउ थर्ड क्वेश्चन इज वेरी इंटरेस्टिंग क्वेश्चन गाइस. A case of unnatural death, a case of murder. Dead body was found in an isolated house with a full of fumes, full of carbon dioxide. Okay, a case of murder, 103 BNS. So the liver is totally cherry red color, cherry red postmortem hypostasis. All the organs are congested, cherry red discoloration is there. Now as a forensic expert, क्या रिपोर्ट देना, बताओ क्या करना, मतलब रिपोर्ट क्या, रिपोर्ट है, cause of death क्या है, क्या हो सकता है. Cherry red discoloration all over the body, especially over the back of the body, gravity area, contact pallor. So liver is also showing cherry red color. That means carboxyhemoglobin is there. Carboxyhemoglobin causes sudden death. ये क्या हो सकता है बताओ, जल्दी बताओ. So ये है कार्बन मोनोऑक्साइड पॉइजन, डेथ ड्यू टू कार्बन मोनोऑक्साइड. ठीक है. So in carbon monoxide what happens, there will be carboxyhemoglobin. Carboxyhemoglobin give rise to cherry red color. It causes immediate death. When it is more than 70%, it can lead to immediate death. Okay, so many cases we discussed in booth bungalow, you can just go through that. Okay, cherry red, बहुत बढ़िया. ठीक है, आगे देखते हैं. हाँ, now I am in postmortem room now. Okay, forensic expert, FMD guru in the postmortem room, booth bungalow room. I'm just entering postmortem room. I'm getting foul smell. बहुत ही bad smell है. ठीक है, and you can see here clearly visible ट्री लाइक पैटर्न है, ट्री जैसा है ना, दिख रहा है ना आपको, ट्री जैसा है. और लाइगेचर मार्क भी है इसमें, ट्रांसवर्स लाइगेचर मार्क है, ट्रांसवर्स लाइगेचर मार्क. एनीवन, व्हाट इज दिस कंडीशन? एनीवन कैन यू एक्सप्लेन मी? सो दिस इज बेसिकली ए केस ऑफ मर्बलिंग एंड ऑल्सो केस ऑफ स्ट्रैंगुलेशन. cause of death is strangulation, the marbling is postmortem finding. ठीक है, ओके, हो गया. ओके, द नेक्स्ट क्वेश्चन, वेरी गुड. रुद्रा, राकेश, very good, all answers. That's great. Filigree, that's okay, fine. Filigree नहीं है, filigree seen in the back in case of lightning. Now look at this again, a case of शव परीक्षा examination, postmortem examination. ठीक है. Now pressure area, so I'm going to examine the dead body like this. Okay, like this. Compression pressure. What you can see here, color change. Pressure, the lividity is color change. Lividity, color change. It become pale. You can see here, pale. So it's a case of postmortem examination, and applying the pressure, the color change occurs in the postmortem lividity. My question is, it is fixed or not fixed? Or what is the time since death? Anyone? Come on guys. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. जल्दी बताओ. Fifth question. This is postmortem hypostasis. Very good. Ratche clearance is telling, sir, this is postmortem staining, not fixed. Excellent answer. Not fixed. मतलब less than 12 hours. So you can tell the police the time since death is less than 12 hours. If it is fixed, more than 6 hours. Some books gives 8 hours. So this is the importance of forensic medicine. Now say example, time is now 8 o'clock. This person must have died within 12 hours from now. 8 around by 12 o'clock, around 10, 12 o'clock, like that, not more than that. So he was alive at the time of 8 a.m. He died probably at 10 a.m. So 2 plus 8, okay, 10 hours. Okay, this is how you can tell and explain in the exam. चलो, बहुत बढ़िया, हो गया. Next is very interesting question, guys. A case of शव परीक्षा examination, the liver shows, for example, this is the liver. लिवर में क्या फाइंडिंग है? लिवर में देखो फाइंडिंग है गैस बबल्स है. देखो लिवर में क्या है? ये नॉर्मल लिवर नहीं है, बबल लिवर है. इसको क्या बोलते हैं हम लोग? दिस इज कॉमनली सीन इन पिट्रीफैक्शन. पिट्रीफैक्शन में होता है, दिस इज नोन एज हनीकूम लिवर. Also known as Swiss cheese appearance. मतलब there is a gas formation. The gas formation means the liver is undergoing putrefaction. It floats in the water. Okay, so honeycomb liver. All of you write in the chat box honeycomb liver in the chat box. honeycomb liver, Swiss cheese pattern. Swiss cheese pattern. So sixth question over. So the first to answer by our friend Rachel Clearance. Rachel. Excellent answer, Rachel. बहुत बढ़िया. Excellent. You are not less than any forensic expert. You are a forensic expert. ठीक है? ठीक है. Honeycomb liver. Anu, Ayush. चलो हो गया. Now seventh question. Seventh question. A bookcase of Booth Bungalow series. Postmortem examination. I am inside the postmortem room. Foul smell is coming out. My junior resident is telling sir, total body is distorted. Total body is bloated. And we can also see some organisms over the body. You can see some organisms are there. So he's asking me, sir, what is the time since death? The police officer is telling, FMT Guru, you just tell me what is the time since death. तो क्या time since death है? ये क्या है बताओ? Anyone? So when you see this type of picture, it must be maggots. याद रखना पड़ेगा guys, maggots. Maggots are larvae of the flies. House fly, green bottle fly, blue bottle fly, forensic entomology. So now you can tell sir maggots है. Maggots है मतलब time since death क्या है? Time since death क्या हो सकता है? 18 to 24 hours नहीं है बेटा. 18-24 hours maggots नहीं होता. 18-24 नो एक दिन नहीं, 2 दिन नहीं, 3 दिन हो सकता है. 3 to 4 days. याद रखना. 3 to 4 days is equal to maggots. Write this in chat box all of you. 10 to 12 days if adult flies are there. Okay, adult flies are there. 10 to 12 days. You can tell, sir, time since death is 3 to 4 days. Time since death is 10 to 12 days when flies are there. Hope you are enjoying the class, all of you. Ayush, Anu, Rafana. Maggots, I think first to answer by Rudra Gauri. Excellent answer, Rudra. Okay, keep writing, all of you. Now, question can be asked, what is the life cycle of housefly? Very simple. The first is the egg. 150 eggs per day. Egg become larvae. Larvae मतलब maggot है. Maggot के बाद क्या होगा? So there will be pupa formation. The fly suckers. So forensic entomology. So very important. This insects, all this, flies, maggots and all very useful to find out time since death. Sometimes poisoning also. Like example, arsenic poison, other poisoning. It also shows the place of crime. So place of crime. So whether urban area, rural area, forest area, village area, drainage area maggots तो नहीं होता. It can be, है ना? So sea water, sometimes drowning as well. ठीक है, yes. ठीक है, बहुत बढ़िया. Excellent answer. Now, very important question, guys. Now I am forensic expert. I am examining retina. Within 10 minutes after death. I am examining within 10 minutes. Within 10 minutes. When you see the retina, you can see retina, fragmentation is there. I'm totally surprised. What is this? Fragmentation of blood in the retina soon after death by using ophthalmoscope. My question is, what is this finding of eye? This finding is known as Kevorkian sign, also known as cattle trucking sign. Yes, guys, are you getting my point? Are you there? Okay. cattle trucking appearance, boxcar appearance. Okay. The next question. Next question is very interesting question. I'll give you 10-second time. Identify what is the finding. What about identifying what is the finding there? Look at this now. Now this is I'm going to tell you the history. History इसमें क्या है? History है history of car accident. Car accident. Okay. So dead body was like this, over the steering wheel. So probable cause of death is cardiac tamponade. Okay. So car accident, the victim was found inside the car, like this over the steering wheel. So body was recovered after 6 hours or 12 hours. The dead body was shifted to postmortem room. Okay, now I'm examining this dead body. Okay, so what is this finding? This is postmortem hypostasis. I'm sure this is postmortem hypostasis. Now my question is, what is this finding? What is this? This is extending from abdomen and to the left shoulder. Left shoulder. Okay, left shoulder and to the abdomen. Left shoulder and to the abdomen. My question is, what is this and what is the importance of this? Anyone, just say like that. I'm telling you, car accident. I don't know whether driver or front seat passenger. He must be driver or front seat passenger. I don't know. The police are telling he is basically driver. But I don't know. But you can tell, you can give report by looking at the dead body. Anyone? You must be knowing seat belt. Right to left to right, left to right, or right to left. So by looking at the seat belt mark, you can tell about the whether driver or front seat passenger. बताओ जल्दी बताओ क्या है? हाँ, posture person है, vivacious है, front seat passenger. Body was in car seat belt, no hypostasis since it is a contact pallor. A seat belt was there, बेटा seat belt है. हाँ, फ्रंट सीट है, सीट बेल्ट मार्क है. सो दिस इज सीट बेल्ट इंजुरी और सीट बेल्ट कॉन्टैक्ट पैलर. सो वी कॉल इट एज विबाइसिस एंड ऑल. सो दिस एरिया इज विबाइसिस. ठीक है, बहुत बढ़िया. तो फ्रंट सीट पैसेंजर. सो try to understand, this is the classical case of postmortem hypostasis, vibasis, sagillation, darkening of death. And it is a collection of blood in the dependent area. Normal color is purplish red or purplish blue. Cherry red color in case of carbon monoxide poison. By looking at the contact pallor, by looking at the postmortem hypostasis, you can tell about the cause of death, poisoning. Sometimes you can tell about time since death by looking at the fixation and all. Sometimes by appearance also you can tell about front seat passenger or driver or back seat passengers. This is how you can interpret findings. Yes, so that's okay. That's बहुत बढ़िया. Okay, now the last question of the day. The last question is very interesting question, guys. Now I'm in the postmortem room. I don't know about time since death. You need to tell me time since death. So look at this, rigor mortis. Rigor mortis at the knee joint. Clearly visible. Then in the same person, rigor mortis is there over the eyelids. Eyelids में rigor mortis है. Look at the jaw. Jaw also showing rigor mortis. Look at the neck. Neck also shows rigor mortis. Fingers also. Fingers also rigor mortis is there. Toes also. My question is, what is time since death? देख के बताओ time since death क्या हो सकता है in the same patient. Now come back to this picture. So it is there everywhere, including toes and also fingers. Yes, it is rule of 12, so it is more than 12 hours. More than 12 hours. Excellent answer. The first two answer by who decay. Who decay, excellent answer. बहुत बढ़िया. Rudra is answering this. Rudra, very good. Anu is also answering, great. Rafana, great. Pradeep Mali, Pradeep, very good answer. Pradeep, all answered. So what is your final score? What is your final score out of 10? So we discussed 10 questions today. All 10 important image-based questions from the beginning. I will just go through. This is mummification. This is supravital reaction. This is carbon monoxide poison. This is marbling. Postmortem hypostasis unfixed. Honeycomb liver. Maggots. Kevorkian sign. Front seat passenger. Contact pallor. And more than 12 hours rule of 12. So this completes today's session, that is Thanatology. Your score, guys. Okay, Pradeep got 8, Anu got 9, Refana got 8. Good. Yes, any doubt, guys? Any feedback about today's lecture? I think this is crispy and short lecture. Very crispy and short. Your exam is on 10th. Just go through all FARRE questions. Rudra, Gaurav, just go through all FARRE questions from the lecture 1 to lecture 6. We completed 6 lectures. We have 2 more lectures, toxicology lecture. Go through all FARRE questions, all image-based question, and also practical session. Definitely, it is very, very helpful. Rakesh. Forensic is a very small subject. So 8 classes is fine. It's okay. We discussed all the important topics in live batches in a beautiful way. Slow and steady. Now this is exam time. Rudra, are you from team? Okay. Rakesh, when is your exam? I think Rakesh exam is probably in September 8. September 8. Okay. Okay, friends, thank you, and don't forget to write feedback about the class. Any doubt in the comment section. Thank you all. We'll come up with some more Booth Bungalow series, some more interesting classes, some more interesting topics in toxicology 1 and 2. So, like in toxicology, we are going to discuss snakes, OP poison, gastric levers, carbon monoxide poison, cyanide poison. So, in a clinical based manner. So, not usual forensic class, in a clinical based manner. So, like a two-way interaction, image